Hey guys, welcome to another episode of Modern Health with Dr. Jane. Of course, I'm Dr. Jane. I'm a naturopathic doctor and natural fertility expert, and I help couples who have been struggling with infertility for over a year get to the root cause of their infertility struggles and help them conceive naturally. Today on my podcast, I want to talk about prolactin. I love using my podcast as a way to help you educate so you can take more control of your fertility journey and feel more confident whether you're going to the doctor or looking for a practitioner or just figuring out things on your own. My podcast is a way to help you educate so you guys can bypass some of the common mistakes that I see my patients make that really prolongs their journey. So prolactin is one of the things that I want to talk about because it's something that gets overlooked, or if it doesn't get overlooked, you just get prescribed medication without addressing the root cause of high prolactin levels. So what is prolactin? Prolactin is a pituitary gland hormone. It's produced by the pituitary gland, and it is produced when there's stimulation from the brain after childbirth to make milk, for milk production. But what happens if you're not pregnant and you don't have a child and your prolactin levels are high? What does that mean? And there's a couple different things. There's optimal levels of prolactin in a non-lactating woman, and then there is kind of mildly elevated, and then there's significantly elevated. So significantly elevated levels are anywhere like 100 to 200 nanograms per milliliter, and those are considered very high, and the most common reason for that is a prolactinoma. So it's actually a benign tumor that's pressing on the pituitary gland and is causing the pituitary gland to produce more prolactin. And the most common way you're going to treat that is actually with medication. Now, when we're talking about mildly elevated prolactin levels, and this is where I get a lot of people versus, hey, you've identified, and then you can actually get an MRI, CT scan, and you can see the brain tumor, and then you can be put on medication. And sometimes you'll find that even before you're trying to conceive, because you'll be lactating, and then you'll have irregular cycles. So you're not ovulating properly because your body thinks that you're breastfeeding, so then you're not ovulating. So that one, I don't want to say it's pretty quick and easy to fix, but it's usually pretty quickly identified. The one that isn't is this mildly elevated level, so anywhere between 20 to 50 nanograms per milliliter. Why is that elevated, and what are the optimal levels? So optimal levels, you're going to see, I'd like to see them around 10. Below 15, around 10, even below 10. Those are all good signs that the brain and the ovaries are communicating really well, and there's not a lot of stress on the body, because the higher that prolactin gets, the more your brain starts to get confused, and you might not actually have any milk production, but what might start to happen is this irregularity in your cycle, or maybe that the ovulation isn't as strong as it should be. And strong ovulation is really important because strong ovulation is a sign of a good quality egg coming through. The higher the likelihood of the fertilization to happen. So here's where I see a lot of doctors just kind of brush this off, this mildly elevated levels, because you do not have a benign tumor on your pituitary gland. And so then let's just put you on medication, which is the same approach that you would use for the prolactinoma, without addressing the root cause as to why. Because if you don't have the tumor, then why is your body producing more prolactin? And if you don't have a baby and you're not breastfeeding, then why is your body making more prolactin? This is the kind of critical thinking that I'm really trying to instill in my patients, but in also my viewers, in my listeners, you guys, because a lot of the times we just take our doctor's word as is. We don't do any more research, and maybe there's something inside of you that goes, that doesn't make sense, but I really want to get pregnant, so I should just take this medication. And so instead, I really want you to start asking why, being curious, because the body doesn't do anything without a reason, including elevated prolactin levels. And for some of my patients, the prolactin levels are at like 25 or 30, which depending on which lab you look at, it could still look like it's within normal range. So anything just slightly above 20 may look like it's still within normal range, where in reality, it's suboptimal because remember, we want it under 15 and ideally under 10. So what is the reason for this prolactin to be this mildly elevated levels? So there's certain medication, especially those that are going to affect dopamine pathways. So any antipsychotics or even anti-nausea drugs can increase the levels of prolactin. So if you're not on those medications, then we can go ahead and rule out that that's the reason that yours is up. But here's a more common reason: hypothyroidism. So when your thyroid is underactive, it can actually cause an increase in prolactin levels. And then another thing that I see is actually just stress, high stress on the body. So whether it's things like vigorous exercise, fasted exercise multiple times a day for the female without changing it based on what's going on in your body, is a stress. When I talk about stress, I'm not talking about just the mental and emotional stress that you're experiencing. I'm always talking about the stress that your physiology is experiencing on a day-to-day basis. So our environment is so different now than it was 50 years ago, and definitely what it was 100 years ago. We are now sitting for most of the day. We are now sitting in front of computers for most of the day. So not only is that the blue light and EMF exposure and all of this sitting and stagnation, but it's what we are not doing during the day, which is getting sunlight, walking, moving our body, and then we're not eating real food. A lot of us are eating processed foods, and even if you are eating whole foods, you're not eating local, and maybe you are, which is great. That the whole point is to decrease the stress. But what I'm saying is there's such a high load of stress on the body now that we forget that our physiology hasn't changed. Our physiology still requires us to get sunlight. It still requires us to get fresh air. It still requires us to move, sleep 7 to 8 to even 9 hours a night. Depending in the winter, you're going to sleep a little bit more because there's less sunlight. And so because we're not doing all of those things, and then our food quality has really gone down and we have a lot more environmental toxins, which then further deplete our nutrient levels, we're in this hot mess of the body being constantly stressed out and not having enough nutrients to deal with the stress and to repair the tissue and restore the tissue basically to its level. That's the stress that I'm talking about. Now, if you feel stressed just listening to it, yes, it can be. And so what I want to say is, hey, if we're not aware, like I think the saying ignorance is bliss, I don't think we're at that point anymore. I don't think ignorance is bliss anymore. I think we just need to become aware of our environment, because it's not just about what's happening in your body and in your house. It's very much about what's happening in the environment around us. And if you look at the quality of the air, that has really changed. The quality of the water has changed. We're seeing a lot of animals being extinct, a lot of really drastic weather changes. And so we know that we just have to change as humans. And it's a reflection in our bodies. A lot more people are sick. 1 in 6 couples are struggling to conceive now, and they're predicting that number to keep getting worse unless we do something about it. And so prolactin is one of those sneaky hormones that seems like, I don't know why it's high. But what I see with my patients is it's usually high when there's all of this other stuff going on. And whether it's your liver enzymes are elevated, or there's inflammation, or you have a bunch of gut infections, or you have heavy metals or other industrial environmental toxins. When you look at the whole picture, all of a sudden it makes sense why prolactin is high and why maybe that ovulation is disrupted. It might not be irregular. You might have a quote unquote normal cycle that's 27 days, 28 days, 30 days, whatever. But what you might notice is that, well, you're not getting pregnant. And that's usually a sign of ovulation not being very strong, and the quality of the egg is compromised. Of course, the quality of the sperm can be compromised. And then the overall environment, aka the uterus, the womb, the first room where the baby will grow in. And all of these pieces are connected. So if your prolactin, if you have never tested your prolactin and you've been struggling with infertility for a long time, you should just take a look at what the number is. But I only say that because I do not want you to be put on medication thinking that that was the only reason my prolactin was elevated. And so as soon as I get put on the medication to decrease it, then the pregnancy will occur. If that was the case, then everybody would just get pregnant who had high prolactin levels and went on medication. But it just doesn't happen. It's the same as saying, I'll just go on birth control and balance my hormones. Sure, now your painful periods are gone, but your hormones themselves have not been balanced. And even with thyroid medication, I have a lot of women who get prescribed thyroid medication without any follow-up or follow-through on what they can do to get off the medication. They're just told that they need to be on medication for the rest of their life. And that's absolutely not true. I take women off thyroid medication all the time because the body isn't static. The body is always changing. And so if something is out of balance in the body, that means something in the environment is causing that imbalance. And so when you get your prolactin tested and you see the number is above 15, so it's suboptimal, the next thing that you need to look at is, well, what are my other markers doing? We're never going to base a treatment based on just one marker. Never. There's not one single test, not even like the gut zoomer analysis that I do, that's going to tell you everything, which is why I often run multiple things. I run the blood, the urine, and the stool, because it allows me to see the whole picture. And I can really see where the issues are stemming from versus what is just kind of cleanup on the side that needs to be done. And then, of course, when we are dealing with a bigger stuff, you're going to notice faster results. If you haven't had your prolactin tested, please go ahead and test it, especially if you've been struggling with infertility for a long time. And then if it is out of range, make sure you're looking at all these other numbers. So I have a fantastic podcast that's called Labs Are Normal, Now What? And I very much go into depth of what the labs should be and, what's optimal versus not optimal. And you can go a little bit more down the rabbit hole yourself. But the idea here is if you've been struggling for a while, you probably need to find a practitioner to help you as opposed to doing it on your own. If you're just brand new to this space and you want to learn more and you want to feel more confident in your fertility journey when you are ready to take the plunge, that's good. Then absorb all the information that you can and try to make sense of it. And then, of course, I have different ways that you can work with me if you're just starting out versus you have been trying to conceive for a long time. You're going to need different kind of support. So if you are interested in working with me, go ahead and fill out the form that's linked below to my Maximize Your Fertility application program, and I'll review it and my team will get back to you within 24 to 48 hours. We're pretty good at getting back to you. But I hope you guys found this helpful and insightful, that your prolactin levels do tell you something about your health, and it's important to assess entire picture before we're just prescribing medication, because the medication for the most part does not treat the root cause of the problem. And unless you have the prolactinoma and there is a benign tumor in your pituitary gland, that's a different story. But it is possible for the body to heal tumors and cysts and adhesions and all of that jazz when you put it in the right environment and when you understand the root cause. So even that, I don't like putting limitations that you need a medication. But for the purpose of this podcast is like, hey, if you have a prolactinoma and you're trying to get pregnant, you need to be on the medication. But thyroid and stress are the most common reasons that I'm seeing in my practice that are causing issues with this mildly elevated prolactin levels. Like I said, if you're interested in learning more about what it's like to work with me, go ahead and hit the application button below and fill out the form, and we'll get back to you within 24 to 48 hours. Otherwise, if you guys can hit the follow button, share this with somebody that you think might find this helpful and give them some more answers in their fertility journey, I would greatly appreciate that. I appreciate you for tuning in. Thanks so much for being here, and we'll see you next week.